Empowerment Through Knowledge Publishing and Serena Stone present the Tequila Drinker's Guide to Health and Wellness Radio Hour with your host, author and medical Qigong educator, Serena Stone. Featuring the director of the Universal Healing Tao and author of dozens of books on natural health and longevity, Tao Master Mantak Chia. This show is for all of us who work hard and play hard. Those of us who are willing to try new things to improve their life, and those who will not tolerate victimization as an answer to health and wellness issues. And now, the Tequila Drinker's Guide to Health and Wellness, Episode 22, Medical Marijuana, Part 2. Today's show is about people who have used medical cannabis to fight or cure cancer, arthritic pain, inflammatory ailments, post-traumatic stress, and seizures without getting high.
Welcome back, listeners. So today we have part 2 of our interview with the infamous Jay Moon. Jay Moon is a cannabis practitioner and has been cultivating cannabis since 2005. He began dosing cannabis as a medicine in 2012 when his friend was diagnosed with cancer. Today, Jay specializes in dosing cannabis oil to fight cancer, manage pain, reduce seizures, greatly reduce arthritis pain in particular, fibromyalgia, and PTSD, to mention just a few, without the side effects of being high. He works directly with clients to develop protocols that work to reduce pain and in some cases cure disease. And that's pretty incredible stuff. Today our show is a little bit different than normal. I'm not going to ask Jay a whole bunch of questions. I've actually asked Jay to do this part 2 and just share stories, because now he's been in this business for years and he has seen some, I don't think I can say that word. He's seen some stuff.
Yeah. Yeah.
He's seen some stuff. So today's show, listeners, is a little bit different. It's just going to be storytelling from our new friend Jay Moon here. So hi, Jay.
Good morning.
Woohoo. All right, so here we are in California. Now, if you hear a truck outside or dogs bark or whatever, it's because we're in a gorgeous house here in what we would call the Valley. Yeah. And Jay and I are just having a coffee. And now maybe tell some stories, which I hope you guys are going to like. So, Jay, let's get right into it. And I know you have a lot of stories. Yeah. I know there's a lot of really good ones to draw from. What I want you to do, Jay, is think of a story that might apply to either most of our listeners personally, or because they know somebody who had that pain or that ailment. Okay, now it's really early in the morning, and usually I phrase questions better than that. I'm almost tempted to turn this off and start over. What I mean is a story we can all identify with, because we don't all identify, with earaches, for example.
Exactly.
So what kind of pain or what kind of ailment do you think most of our listeners have either personally dealt with, or at least they have somebody that they're close to?
Let's start with arthritis. Okay.
Yeah. Is that joint pain in general?
Yes.
I mean,
yes,
there's so
absolutely.
much stuff that can go wrong with that.
Yep. Sciatica, arthritis, joint pain, sore muscles, things along that nature. And what I really want to focus on today too is not just the stories, but the dosing information, the simplicity of how to apply cannabis as a medicine. And as we talked about in part 1, what cannabis really is when used as a medicine is a nutritional supplement that your body knows how to utilize to heal itself. And in the case of arthritis, cannabis is not going to heal your arthritic joints. What it is going to do is modulate the pain signals within your body so they're either greatly reduced or eliminated. It doesn't take much either. Cannabis comes, when you look at what's on the plant, cannabis is a cannabinoid. THC, which is the psychoactive part of cannabis, it'll get you high,
Okay.
and CBD, which pretty much won't get you high. Those are cannabinoids. When you take 20 milligrams, and you can take that in the form of a pill or in the form of a sublingual spray. So if you buy a sublingual spray bottle, little spray bottle you spray under your tongue, and you dose 20 milligrams daily, and you then take an infused salve or cream that's made with THC, and that only needs to be infused at a rate of 1%. So there's very little, a small amount of active ingredients in that cream. So you apply the THC cream to the joint areas or the sore muscles or the sciatica nerve, and you spray the CBD underneath the tongue. And I promise you the results are miraculous. Within a half hour, your mom or your dad or the individual that you're working with our arthritis will start to flex their hands, and they'll look at you in amazement. And the next day, it gets even better and better as they continue to use that product.
That is the sound of Jay touching the
Yeah.
table. He's very excited, and rightly so.
Yeah, it's
Anybody who loves their grandpa, loves their grandma, and watches as their hands begin to curl into these horrible twisted things, and knowing that their loved one is in pain all the time, should get excited about what you're talking about.
I'll tell you a story. My father-in-law was came to visit last summer, and he woke up on Sunday morning, and he looked tired and haggard. And I asked him, "How'd you sleep, Jack?" And he looked at me. He showed me his fingers. They were swollen like sausages. And he said, "I've really bad arthritis. I've been to the doctors. We've tried everything." And so I gave him a sublingual CBD, and I said, "Spray that underneath your tongue, 5 squirts, and rub this on your fingers and hands." And he looked at me, he was open-minded, and I'm sure that he was skeptical.
Yeah, so it's okay.
I mean, in his shoes, I would have been too. And within a half hour, he's looking at me, and he says, "I am flabbergasted. I cannot believe the difference."
I got a question, because the moment you mentioned arthritis, when you looked back at his hands, do you happen to remember if they were as swollen as when he got up?
I don't recall. I didn't look.
Well, here's my question, and this is a huge one for those who are studying natural medicine. Do we have any stats on inflammation and our use of CBDs and THC? I just wonder if we're only dealing with pain receptors, or if in some way we're reducing inflammation, which in itself would reduce pain.
Jack, he continued to use the product daily. 30 days later, the swelling was gone. The inflammation was eliminated in his...
Okay, that's huge. That is huge. Huge.
And here's... Yeah, it is. It is. I'm also working, and this is directly related to inflammation. I'm working with a doctor who owns a pharmacy. He's a compound pharmacist as well as a doctor. His dad is suffering from kidney failure, and this doctor did his research on CBD, found me, and said, "Jay, my research indicates that CBD is an excellent anti-inflammatory, that it will reduce inflammation. And I believe that if we dose my father with high-dose CBD, that it will reduce the inflammation in his kidneys, and his kidneys will improve."
Of course.
So...
not of course that would work, but of course if you could reduce the inflammation,
in theory,
we can get energy and liquids to flow through, period.
It was sound. We began, and his father is in his mid-80s and is on medications to prednisone and steroids.
Oh, no.
So yes, he was. So we began dosing at 10 grams over a 30-day period. So, and we delivered that dose in the form of a rectal suppository. And
my favorite.
Yeah. We'll get to the vaginal suppositories in a minute.
Folks, you hang on and keep listening to this show, because we're going to be talking about those suppositories next.
Within 30 days, Dr. V had called me back and said his father's numbers have improved dramatically and they are reducing the medication. And we decided to increase the dose for month number 2. Same thing reported month number 2. The numbers that they track in reference to his kidney that determine the amount of prednisone that they were dosing Dad on, those numbers have continued to drop because of the CBD suppositories. Right now, we're in the midst of month number 3, but Dr. V is ecstatic with the results.
Of course. Oh my God. I mean, this is just, that is life-changing. Listeners, I invite you to Google inflammatory disease or the word inflammation and the words inflammation and physical health. Google these things and you're going to see that right now the hot topic in health is inflammation. I mean, inflammation can be as simple as, ooh, I ate something that my body doesn't like. My intestines are inflamed for 24 hours, and now I'm constipated and toxic, which is actually huge. It can be that simple, something short term, or we can be talking long term. For example, when these people have arthritis, the body will send water to the fascia. And listeners, we've spent a lot of time talking about connective tissue and fascia. The body will send water to the fascia to protect that area and give it some structure and stability. But I don't know, it seems like there's some error in how we're built or something, because that philosophy doesn't actually work. Somebody needs to tell the universe, stop doing this, because the more water we send to that area, the less the blood flow and the chi can flow in that area, and it'll kill you.
What's the precursor to all disease?
Precursor to all disease. Well, in Chinese medicine, it would probably be inflammation. Yeah.
And CBD is an excellent tool, a nutritional supplement to reduce or eliminate inflammation.
Now, Chinese medicine experts out there, when I say inflammation, I know you would say the term stuck chi. That is the root of all dis-ease. Same thing. Where there's inflammation, the chi is not flowing well, and the information is not flowing through that area. It's all stuck and focused on what's wrong.
Yes.
Okay? So we're finding here with a little bit of Mother Nature, right? Our CBDs, our THC, we can send an alternate message to our cells, and they're responding.
Yes, they are.
That is huge. Okay, now I want to transition us. Listeners, I said we were going to be talking about these suppositories. So if you have a weak stomach, you can shut it off. But for the rest of us, a suppository is something you're going to put up your butt. Okay, that's or it could be vaginal.
Back door, front door delivery method.
Jay, would you just explain to us, in what situation would you prefer not to ingest, meaning to eat? You would prefer not to ingest, and why we want to do a rectal or vaginal suppository? Why did you even come up with this?
Great question. For dosing cannabis, I have what's called microdosing, say for arthritis. Okay, 20 milligrams of CBD under the tongue, sublingual, with an infused salve is a microdose.
Meaning it's very small.
Very small. Okay?
But it has a big reaction.
Exactly. Okay. Exactly. PTSD. We can dose PTSD with 20 to 30 milligrams of CBD, starting dose, sublingual, under the tongue. Great reaction. Big results. We're starting to, if not, sometimes we can cure these issues, but in many times what we do is simply mitigate the symptoms to where someone will say, my pain's gone from an 8 or a 9 to a 2.
Okay.
And that I consider to be a great result.
Yeah.
A great result, okay? So microdosing is utilized in those areas where we can achieve those dramatic results, but where medicine, where the body requires more of this medicine, the problem with cannabis is it gets you high. Okay, and most of us
definitely can't operate heavy machinery
right.
or drive a car.
I mean, we've got most of us out there. We've got a life. We've got a kid. We've got college or work or careers and more. There's just you just can't be high 24/7.
No,
no. And at these higher doses that are required to affect change in the body, the big deal is when cannabis is delivered as a vaginal or a rectal suppository, it bypasses the liver and does not become psychoactive. So it goes directly through the intestinal wall into the bloodstream and circulates through your entire body. It eventually gets to the liver, but here's the good news. When you take an oral dose of cannabis, like eat a brownie or a pill, it goes through the digestive tract, through the liver, and that's what we call first pass through the liver. And it's that first pass through the liver that it becomes psychoactive. So I can deliver someone high-dose cannabis oil therapy. It's a nutritional supplement therapy, either vaginally or rectally, without the side effects of being stoned.
That's huge.
It is huge, okay? The problem that I experienced in the beginning with dosing patients, because and one of the things is to talk about cancer. Cancer's huge in this arena. I do a lot of work in this arena. And a very dear friend of mine, a hippie from the 60s, told me, this was 5 years ago, she had lymphoma cancer. And she said, Jay, cannabis oil cures cancer. I need you to figure it out for me. And I left that day thinking, oh my God, it's going to help with nausea. It's going to help with appetite, but cure cancer? Give me a break. And I went to the stores in LA and I talked to my contacts who work in the cannabis industry, and they referred me to a gentleman who had done just that. He'd cured his cancer 15 years ago. And Taras taught me the craft, the art of using cannabis to cure disease and mitigate the symptoms. And I learned about the cannabinoid system, and I learned how cannabinoids are made in our body, and they're the body's mechanism for healing on a cellular level. And I learned that the cannabinoids are found on the cannabis plant. THC and CBD are cannabinoids. And the body uses that as a nutritional supplement to heal itself. And when you apply that to cancer, in order for us to get, we've all heard about people being cured of cancer using cannabis oil. I've done it.
Right.
I've done it with a lot of people now. And in order to achieve that result, you've got to dose at high levels.
Okay. No, so no more microdosing.
Nope,
not if you've got cancer.
You've got cancer, microdosing's out the window. It's not going to work. Okay.
So you told us about the doses on what a microdose looks like. What are we talking about here, Jay, for a non-microdose? I have cancer that I need to kick out now.
Rick Simpson is the pioneer on this topic. Rick has worked with thousands of people in dealing with their cancer in relation to cannabis.
Okay.
We all stand on his shoulders and owe him a debt of gratitude that could never be repaid. Rick's formula was real simple. 1 gram a day, eliminate sugar, and take your cannabis oil. He'd also, and I disagree with him, he'd say...
Wait a minute, 1 gram a day all at the same time?
1 gram a day. How he got that into the person was through an oral dose. And yeah, and that's what I did for a couple of years with clients. And it takes a special individual to week after week increase their dose and get to it 1 gram a day. 1 out of 10 people could possibly do it. Whereas with suppositories, you take a 0.5 gram in the morning and a 0.5 gram at night. And I don't care if you've ever used cannabis or not. The only side effects associated with that will be you're sleepy and tired, possibly. 1/4 of my people say sleepy, tired, and forgetful. The other 3/4 say I'm fine. That's it. But all of them are working, driving, going to their doctor's appointments, functioning normally. And that's the beauty of this.
All right, hold on a second. You said you've had experience working with people that have cancer.
Mm-hmm.
What do you think is one of the most common? Cancers that you run into? Is it different for men and women?
Sure. We see a lot of breast cancer today. Okay.
Okay.
That is an absolute horrible disease. Breast cancer is primarily, it's either estrogen driven, and those are what we see a lot of today. And that's ER positive. I currently work with 4 or 5 women in reference to that. To date, we've been able to cure 2. One we did
I'm sorry, how many women have you worked with that have it?
four or five.
4 or 5. Let's call it 5.
Uh-huh.
And 2, so
Are
that's
cancer-free.
just under half, are cancer-free at the moment.
Right. One.
Did they use some other? Did they combine your the natural medicine with Western medicine?
One did,
Okay.
and one did not.
Okay.
Lori did only natural medicine. She worked in conjunction with a doctor that I work closely with.
Okay. And we shrunk tumors. Is that what you're saying?
No, we eliminated them. They're gone.
All right. I would never have been so bold. All right. Listeners, that's something.
That's what the scans tell us from the imaging.
Well, we know how big they were, and
Yeah.
if they no longer exist, I guess that
It's gone.
It's all right there.
It's gone.
Okay. And the other one?
The other one, Robin did work in conjunction with Western medicine, utilizing chemo and radiation, and that cancer is also gone per the scan.
Okay, so listeners, this is not just what Jay's talking about. Isn't just for folks that only want natural medicine. You're not anti-Western medicine completely, are you? I mean,
No.
you work with people and their physician if that was their
Absolutely.
their wish. You would respect that.
Oh, completely. Absolutely. That's a
Okay.
personal choice and a road that only that individual can make. And I will state this, that with an estrogen-driven and ER-positive breast tumor, the protocol that we utilized was 10 grams of CBD cannabis oil monthly.
Okay.
Okay? That works out to about a 300 milligram dose daily in the form of a rectal suppository. And the reason that we focus on CBD in an estrogen-driven tumor is THC has been shown to increase the growth of an estrogen-driven tumor.
Oh, listeners, that's important to know. What I'm hearing here, Jay, is that this is medicine. We should not be dosing ourselves. We should not be figuring this out on our own. We should go to somebody like you with an education, because if you don't know that an estrogen-based tumor should not be fed THC, this could end badly. It's medicine, no matter how you look at it.
That's right.
This is the ultimate in plant medicine. And we need to work with educated professionals so that we make sure that we're properly diagnosed. I think that's a great way for Western medicine to be involved, right? They're experts in diagnosis.
Correct.
So I think we all agree with that. And then, you wouldn't go out and try to self-diagnose cancer. So why would you try to self-dose any of the medicines? That's what I'm hearing when I listen to you speak. You have a background. And we need that. So listeners, I wanted to drive that point home. All right, let's move to a different kind of cancer. Let's talk about boys for a minute. What do you see out there for guys? I see a lot of prostate issues personally.
Prostate, absolutely. Prostate, stomach, liver, bladder, colon, absolutely.
Okay.
Prostate cancer, very effective tool. Rectal suppositories are the prescribed delivery system for a multitude of reasons. One, you get more of the medicine into the bloodstream. Two, it's in the localized region. We are very successful in the treatment of prostate cancer. There are several protocols. Here's the one thing I need everybody to know going in about dosing and protocols in relation to cannabis. Prostate's an excellent example. I work with one individual who we started and his PSA number was at a 10. We began with a 2-to-1 protocol. And when I say 2-to-1, that first number is always going to be the CBD content. The second number, the THC. So if I have a 2-to-1 protocol, hypothetically, let's just say I have 6 grams of CBD and 3 grams of THC, I'm working a 2-to-1 protocol, twice as much CBD as THC, which is a prescribed method for prostate cancer. And we worked that with Paul, and over the next couple of months, his number was cut in half. He went from a 10 to a 5. And then we were jumping for joy. And he's not doing anything, no Western medicine whatsoever. This is all through nutrition and cannabis. Then that number started to climb again, and it went to a 12. And I changed the protocol. it actually had climbed as high as a 15. I constantly changed the protocol when the results were not what we wanted. We have gone from a 2-to-1 protocol to a 1-to-1 protocol, so half THC and CBD. When when his PSA number crept back up to a 15, I went to a 90% THC and 10% CBD. And increased the dosage dramatically. We went from 300 milligrams a day to 1,000 milligrams a day. And we dropped that number down from a 15 to a 9. Okay? So when you always have got to know that cannabis, we don't have a way to do a cannabinoid deficiency profile. We don't know where your body's deficient in cannabis. We can check your iron, your vitamin C, your vitamin D. We can figure out a whole bunch in relation to nutrition, to where you're deficient and where you need help, but not with cannabis. Because it is a Schedule 1 drug. There is no test available for the doctor to say, what's your cannabinoid deficiency panel look like? We don't have that test available. So we are dosing based on results, based on anecdotal evidence. That PSA number dropped from a 15 to a 9, and we knew we were on the right track. Okay? So
this story is about somebody you're currently working with?
Yes.
Okay, so this story's not really over then?
No, it's not.
Okay.
No, it's not.
Has there been anyone, and I cannot believe we're already at 25 minutes, that went really fast. Is there anybody who's had prostate cancer that you've worked with, whether they combine Western medicine or not, who's actually stopped it?
Oh, yeah. Yeah. Oh, yeah.
Oh, you do? So you've seen it go away?
Mm-hmm. Absolutely, we have. Yes, we have. One story I have to tell that it's incredible. Tom. I love Tom. He came to me almost 2 years ago with liver cancer. They diagnosed him in the emergency room with stage 4 colon, stomach, and liver cancer. They told him in August that you'll never see Christmas, put your affairs in order.
Okay.
He's in my office 3 days later. We started him on 1,000 milligrams daily, a gram a day. The first month, we gave him a CBD half gram in the morning and a THC half gram at night. After that, and each month thereafter, he received a gram of THC daily in the form of a rectal suppository. By Christmas, his stomach and colon was clear. By spring, in February, March, they told him that the tumors on the liver were dead and that they were scheduling him for surgery to resection his liver. They did so, and they told him that he is an absolute modern miracle.
Wow. Now there's a story. Whew. That gave me the chills.
Yeah, I spoke to him yesterday. He's doing well.
That's incredible. That is amazing. All right. Well, like I said, Jay, 25 minutes just came and went. Actually, we're at 27 now. I don't even know how that happened. Folks, I'm going to be posting a website for Village Flora. We'll put up just an email address so that if you have questions for Jay Moon, on behalf of yourself or maybe somebody that you love, you can go ahead and send an email. How long does it usually take for somebody to get a response from you? I'm sure you're a very busy guy.
Usually within a week. Within
about a week. Okay. So, now we have that. And, Jay, I just wanted to thank you for all the work that you're doing for us. You know, what did I call you the other day? You're like a bushwhacker out there, just forging this path. I know that it hasn't all been easy for you. And I'm hoping now with our new laws in California that life becomes a little more gentle and that you can, you're using your real name. So you're out here in the public eye advocating this medicine. Listeners, I can tell you that I've known Jay not that long, but when we first started speaking on this subject, there wasn't very much support for you out there. I think California had just gone medical legal, but it wasn't particularly friendly.
No, it wasn't.
The environment was kind of rough. And what I watched, I watched this man he'd get teary-eyed as he would talk about some of the successes, some of the reports that you'd read, going, I just know it. I know this is real. I know this is what I'm supposed to be doing. And then as, one by one, some brave soul would give you their trust in their body, and then you were having, these wonderful results, like the stories that you told to us today. I've watched as you didn't give up.
No.
And I think that we all should be at least grateful for the price that you've paid from, year to year. And I think I personally am so happy to see that you're being embraced by, okay, not all the community. Not all the community thinks you're so great, but a lot of us, Jay, are starting to come around. I know you have clients because one of your clients is one of my clients.
Yeah.
We're sharing this one. I know that you're finding a way to effectively communicate the science behind this medicine, because I sent you a very conservative person, didn't I?
Yes, you did.
We all thought our heads would be on the chopping block, but I couldn't find another medicine for her. Nobody knows who she is. Couldn't find another medicine for her skin cancer that would work over the long haul. And I just felt like I didn't know what to do besides introduce her to you. And between the two of us, we opened the door. She walked through it.
Mm-hmm.
Okay. And all of you listeners, you need to get that. Guys like Jay, he will do the research. He will take the risk. He will open the door. But you have to walk through it. If you're ill, if you suspect that, you could be in better health, and that if there was a test for your cannabinoid system, and you know that you would fail it, you have to walk through that door. You have to contact Jay. You have to go onto Google and do your research. We can show you some things. You're the one who has to open your mind and try something new. And in a decade from now, Jay, we're going to sit down and this will not be new. This will be old news.
Cannabis oil and nutrition will be frontline therapy in the war against disease and cancer. And things like chemo and radiation will be the barbaric last attempt.
Wow, love it. Now, listeners, in a couple of weeks, I don't know, somewhere 2 or 4, we will be interviewing Chef Marshall O'Brien, and he's going to elaborate on what Jay said about nutrition. Marshall is expert in helping us to understand why, if you have cancer, you should not eat sugar.
Yeah.
That's bad. And why you don't want to feed your children pesticides and herbicides and things like that. So, Jay, I just want to say thank you for all of your contributions, all your sacrifices, and all your hard work. I want to say that one more time. And listeners, we'll be back next week with Master Mantak Chia.
Thank you for having me.
Bye.
Bye.
Thank you for joining us on another Empowerment Through Knowledge adventure. Want to learn more? Find Master Chia at mantakchia.com. That's MANTAKCHIA.com. Find advanced learning materials, books, and more at serenastone.com. That's SARINASTONE.com. Thanks for listening, and if you like what you heard, please subscribe today. This podcast was produced by J.C. Warfield Productions in conjunction with the Echo Chamber Studio, Minneapolis, Minnesota.